You are watching Redicon. The Fleischner statement was uniquely comprised of a multidisciplinary panel comprising principally of radiologists and pulmonologists from 10 countries with experience managing COVID-19 patients across a spectrum of healthcare environments. It initiated imaging is not indicated with patients with suspected COVID-19 and mild clinical features unless there are risks of disease progression. Number 2, imaging is indicated in patients with COVID-19 and worsening respiratory status. 3. In a resource-constrained environment, imaging is indicated for medical triage of patients with suspected COVID-19 who present with moderate to severe clinical features and a high pretest probability of disease. We will look into those in detail now. The Fleischner statement or guidance describes 3 different scenarios based on clinical features, pretest probability, and resource constraints. The table describes the definition and criteria for key components of these clinical scenarios. The severity of respiratory disease can be mild or can be moderate to severe. In mild, no evidence of significant pulmonary dysfunction or damage, such as absence of hypoxemia or mild dyspnea. In moderate to severe cases, evidence of significant pulmonary dysfunction or damage may be present, such as hypoxemia or moderate to severe dyspnea. The other factor is pretest probability. Based on the background prevalence of disease as estimated by observed transmission patterns, may be further modified by individual's exposure risk and can be subcategorized as low pretest probability like sporadic transmission, medium pretest probability like clustered transmission, or high pretest probability at the time of community transmission. The resource constraint is the third factor, which corresponds to availability of personal protective equipment, COVID-19 testing, hospital beds, or ventilators with the need to rapidly triage patients. The first clinical scenario has mild features, referring to absence of significant or pulmonary dysfunction or damage, with any pretest probability based on the background prevalence of the disease, which could be further modified by a patient's individual exposure risk. In such scenario, a negative COVID-19 test and low pretest probability does not warrant any further imaging. Only if there are high risk factors for the disease progression, imaging may be indicated in selective cases. So, summing it up, in scenario 1 with mild features, with negative COVID testing and low pretest probability, there is no much scope of imaging. However, if the test comes positive or there are high pretest probability with high risk factors, then imaging may be indicated. In the second scenario, with moderate to severe symptoms, any pretest probability, and no resource constraints, imaging would be required irrespective of the results of COVID-19 test results. In cases with negative testing, as seen on the right side, repeat testing or imaging may be required and an alternate diagnosis should be considered. Third scenario is more relevant to most places. It assumes moderate to severe symptoms, high pretest probability, and that resources are now limited or constrained. Moderate to severe features refer to evidence of significant pulmonary dysfunction or damage. High pretest probability is based upon high background prevalence of disease associated with community transmission, and rapid COVID-19 test is point-of-care test with less than 1 hour turnaround time. If the test kit is not available and result is negative in moderate or severe clinical features, imaging is required and consultation suggested for investigating alternate diagnosis. If patient has strong features of COVID, then imaging may help in medical triage and further management. Left side of the picture shows cases where COVID test is available and positive, then imaging may be indicated initially as a baseline and later for monitoring the respiratory status. Summary of Fleischner recommendations. The main recommendations are: number 1, imaging is not routinely indicated as screening test for COVID-19 in asymptomatic individuals. Number 2, imaging is not indicated for patients with mild features of COVID-19 unless they are at risk for disease progression, as seen on scenario 1. Number 3, imaging is indicated for patients with moderate to severe features of COVID-19 regardless of COVID-19 test results, as seen in scenario 2 and 3. Imaging is indicated for patients with COVID-19 and evidence of worsening respiratory status, seen in all scenarios. Point 5. In a resource-constrained environment where access to CT is limited, chest X-ray may be preferred for patients with COVID-19 unless features of respiratory worsening warrant the use of CT, as seen in scenario 2 and 3. There are certain additional recommendations. Daily chest radiographs are not indicated in stable intubated patients with COVID-19. CT is indicated in patients with functional impairment with hypoxemia after recovery from COVID-19. And finally, COVID-19 testing is indicated in patients incidentally found to have findings suggestive of COVID-19 on a CT scan.
This video is presented in collaboration with Radicon Institute of Radiology. You are welcome to subscribe to our YouTube channel and click on the notification bell for updates. For more modules in radiology CMEs, please visit our website www.radicon.org.